In the second part of Chapter 9, we're really going to look at injuries to the face, ear, eye, and nose. Now, most frequently, these types of injuries occur in which the face is unprotected. We're not wearing a face mask or a helmet or have anything protecting our face area. So they can be severe because we don't have this protection, but they can also be very minor injuries that we can properly care for on site if we need to. So first and foremost, we're going to talk about injuries to the face. So let's jump right into it. First and foremost, facial fractures, and these can include, we have many bones of the face, and they typically include fractures to the zygoma, which is the cheek area, the maxilla, which is the upper part of the face or upper part of the lip, right underneath the cheek, and then the mandible, which is the jaw area. And we can see that these, all these areas could be very traumatic if there's a fracture to it. Just like other fractures that we talked about, the mechanism of injury occurs due to a direct traumatic impact to the face, and this could be by an implement, this could be somebody falling, this could be somebody's fist if we're talking about boxing or fighting, but it's something traumatic that impacts the face. Signs and symptoms that we see that are common include pain, a deformity, possible ecchymosis, swelling, inward depression of the bone, and possible laceration. So if it is from an element or some sort of ball during play that is coming in contact with the face, it's going to first impact the skin, causing that to bleed, and may have an underlying fracture underneath that. So we do see in the textbook describe some specific signs and symptoms for each type of facial fracture. So for a zygoma fracture or a cheekbone fracture, they usually have a cheek flatness on that side, abnormal sensations, and possible blood in the eye on the injured side and visual disturbances because of that. For a fracture to the maxilla or a maxillary fracture, the person could have malocclusion, and malocclusion is the inability to bring the teeth together in a normal and aligned fashion. If we were to clench our teeth, it will be out of alignment. We may also have visual disturbances because it is close to the eye, as well as clear fluid coming from the nose and difficulty breathing. For the mandible, our common signs and symptoms that we see, or specific signs and symptoms for the mandible fractures, include malocclusion as well, just like a maxillary fracture, as well as the same clear fluid from the nose and bruising under the tongue and jaw pain because of the area of injury. This is a typical fracture, possibly on the left-hand side, that we would see from a zygoma. So right underneath the eye socket, we see the zygoma or zygomatic bone, that is the cheekbone, and this could become fractures causing that bruising underneath the eye. For treatment, we need to call EMS as soon as possible. If it's very traumatic, we need to make sure that we treat for shock and control the bleeding. If it's occurring at the zygoma or possible the maxillary area that's very close to the nose, so the nose may be impacted as well, causing a nosebleed or epistaxis. So we need to control that bleeding so they may not freak out and go into shock. Prevention, again, we need to make sure that they wear face masks and proper equipment, avoid any direct trauma to the face, and make sure that they follow the policies and procedures and rules when participating in an activity. Again, we may have laceration and incisions, just like we did for the head. These are very, very similar signs and symptoms mechanisms as we saw before, but mechanism is a direct blow or possibly an area or an object rubbing against the skin repeatedly on the face. That's causing that abrasion to the skin, which could cause bleeding. Remember, these are very susceptible to infection as well. Signs and symptoms, we see bleeding, pain, swelling, point tenderness, really localized to that area. For treatment, because this is a laceration or an incision, we're going to have bleeding, and because it is on the face, it's going to bleed a lot because of the amount of blood vessels. So we need to make sure that we control the bleeding and refer the athlete as soon as possible after we control the bleeding for stitches. Anytime that we do see a laceration or incision on the face, we do refer to a physician or the ER for stitches, because we really want to minimize scarring as much as possible on the face compared to other parts of the body. Prevention, the same as what we saw before, were protective equipment. TMJ, not as common, but we do see this sometimes in athletics. But this occurs at the temporomandibular joint, and TMJ in this situation becomes inflamed and painful with overuse, and it can become dislocated in some situations, but it's caused by a person opening and closing the mouth a lot, such as when they're talking, or when they keep their mouth open often, if they breathe through the mouth often, if they sleep with their mouth open, if they're or a direct blow to the TMJ. Signs and symptoms: decreased motion of the jaw, pain around the jaw area, possibly around the ear, inability to close the mouth or malocclusion of the jaw, and that person could be complaining of hearing or feeling clicking or popping around that jaw area. Treatment, we need to have the athlete rest with their mouth closed. Try to rest that jaw as much as possible. Apply ice, maybe some non-steroidal anti-inflammatories or NSAIDs to decrease that swelling. If the TMJ is dislocated at any time, we need to make sure we call 911 and monitor breathing before EMS gets there. Prevention, I know it's hard, but avoid opening and closing the mouth frequently. Sometimes we can get a prescription for anti-inflammatory, or maybe we can get a custom-made mouthpiece to prevent any other further temporomandibular joint dysfunction or injuries to the area. Let's move on to eye injuries and conditions. These are a little bit more traumatic than just with facial injuries. And when we have eye injuries, we can have fractures as well. So there are many bones around the eye. There's actually 6 bones around the eye that make up the orbit of the eye. And fractures in this area can be very traumatic, caused by a direct blow to the eye. And this could be from a fist or a ball, such as baseball. If it's an erratic pitch by the pitcher and it gets the batter right in the eye, it will fracture that orbital and can cause traumatic injury to that athlete. When we suspect the athlete has sustained an orbital fracture, we should also suspect that they have a head injury as well. Most often the traumaticness of this injury can cause a brain injury as well. Typical signs and symptoms that we see, it really depends on the bones which are fractured, but if the zygomatic bone is fractured, which is underneath, the athlete will have a flat cheek on the injured side. If the frontal bone is fractured, which is above the eye, around the eyebrow is fractured, the bone will be more flat compared to the other side, or it may have a lump in the injured area due to swelling, such as a goose egg. The most traumatic is an orbital blowout fracture. This is where really the eyeball appears to be sunken in or bulging out because it has blown out the muscular structures that control the eye, and the eye cannot be used to look around in different directions. Treatment. This is a really a traumatic event for the athletes. We need to call 911, possibly treat for shock and control bleeding if there's any external bleeding. As we treat for it, because the eyes move together, if we are covering one eye or treating one eye, we need to treat the other eye the same, because even if our right eye is injured and we cover that to support it or to protect it, if we look with our left eye, our right eye will tend to track with it and still move the eye even though we have that right eye protected. So we want to make sure that we cover both and treat both in a very similar manner. For prevention, we need to make sure we wear safety eyewear and be aware of surroundings and implements during activity. Next, we'll look at an hyphema. Hyphemas are occur when there's blood that accumulates in the anterior chamber of the eye, and this could be visibly seen, and we'll see this on the next slide. But this is caused by a direct blow to the eye. And really the signs and symptoms of this compared to other eye injuries is that we actually see that blood fill up in the eye that could be going up past the pupil, causing blurred vision or a loss of vision for that individual. Treatment, we need to refer to an ophthalmologist and call 911 and treat for shock. As you can see in that picture, you can see that blood floating up in the anterior chamber. As soon as that gets past the pupil, that individual will not be able to see or have blurry vision. For prevention, we need to make sure they wear protective equipment over the eye. Even if it's a situation where they're going out and play recreational squash or something like that, they still need to prevent this type of injury or eye injuries wearing protective equipment. Next, we're going to move on to corneal abrasions and foreign objects in the eye. And these have very similar signs and symptoms, but the mechanism is a little bit different. When we look at the mechanism of injury for a corneal abrasion, this occurs due to something scraping the cornea. It could be liquid getting in the eye. It could be a small piece of dust or something in the environment that gets in the eye. Very, very small. It doesn't have to be that big. That when somebody blinks, it's caught underneath the eyelid and continues to scratch the cornea of the eye over and over again as we blink. Signs and symptoms include a sensation of something in the eye. This is very similar to what we see with a foreign object in the eye, but this object being in the eye may cause the person to tear up. The eye may be bloodshot, may have blurred vision, decreased vision, or sensitivity to light because that ongoing scraping of the cornea. For treatment, if we are able to lift the eyelid and remove the eye, we want to do so with the proper gloved hands, and also using a cotton tip applicator to remove the object. Sometimes we may not be able to remove the object, so we just need to make sure we refer the athlete to an ophthalmologist or an ER as soon as possible. In order to really classify this as a corneal abrasion, before I get to prevention, you can see that picture. They do a test where they put fluorescent dye in the eye, and then they turn on a blue cobalt light, and they shine it in the eye, and what the dye does, it actually gets into the groove of the abrasion, and it shows up, and you can see very clearly in that picture that abrasion over the eye or over the cornea of the eye where that fluorescent dye sits. And really, even though we're referring the athlete to an ophthalmologist, these typically treat themselves. There's not much that we can do unless the implement is still sticking out or in the eye. Prevention, again, is wearing protective eyewear during activity. For an object, like I said, very similar to a corneal abrasion, but the mechanism is different. So this is when an object flies into the eye or is thrown into the eye, or when somebody touches or something gets in the eye and touches the eye. Signs and symptoms are very similar to corneal abrasion, but the foreign object may be actually protruding from the eye. So this could be a nail, this could be another implement, or God forbid, a pencil that gets stuck in somebody's eye, but something that may be protruding from the eye. Treatment, if it's a small fleck of dust or something that can be removed, remove it. If it's something large and protruding from the eye, I saved you all from all those gross pictures this time, but if it is protruding from the eye, we need to call 911, bandage both eyes for the same reason as before, because they track together and they move together. And if it's very traumatic, then get ready to treat for shock. Prevention, again, wear protective eyewear during activity and avoid touching the eye with unclean hands or try to avoid getting things in the eye as much as possible. Conjunctivitis is our next injury or illness, and it's really pink eye. Pink eye is inflammation of the lining of the eye, and it's typically caused by a viral infection, but it can also be caused by bacterial in the eye, fungus in the eye, allergies, chemicals, or contact lenses that irritate the eye. And really what we see is the eye or the white part, the sclera, becoming pink in color or a red in color because of the inflammation of the lining of the eye. A person could be complaining of itching, pain, blurred vision, sensitivity to light, or some discharge. This discharge typically occurs overnight where the eye rests, and it could cause the eye to feel sticky or be closed shut in the morning. And this is a picture of that sticky discharge that we can see occur in very bacterial, fungal, or virus types of pink eye. Treatment, we need to make sure we remove the athlete from activity to prevent this from being passed on to another person. Pink eye or conjunctivitis is very, very spreadable, very, very contagious, and we need to remove that athlete and refer them to the physician to get the proper medication and care as soon as possible. Prevention for this is practicing good hygiene, making sure that we clean and we don't stick things in the eye. A sty in the eye occurs when a sebaceous gland is inflamed or oil gets in the gland in the eyelid located where the eyelids are, where specifically where eyelashes come out. This is when bacteria enters the gland, causing inflammation, and really we get a pimple-like pustule in that area. It could be red, it could be white, but it's very point tender. It's a swollen pimple kind of object. Could cause the person to tear, be sensitive to light, but it's very painful, very annoying. It feels like there's something in the eye. What we don't want to do is pop that pimple in the area, because this could cause that bacteria to spread to other glands around the eye and could cause additional styes or infection. Treatment, we can apply a warm compress to soothe the pain, but if the sty does not resolve within a week, we should refer to an athlete to a physician. There's also over-the-counter medications and things that we can apply, ointments or drops that we can apply to the eye. There's also, specifically, it's called Stye. For a sty in your eye, it's an ointment that you can rub on the side to help decrease some of that inflammation. Prevention, similar to foreign body, make sure that we wash our hands and not get anything in the eye. Second to last, we have ear injuries and conditions. When we look at ear injuries, there's only a few that we'll look at. The first one is we're going to look at tympanic membrane ruptures. This is a rupture to the eardrum, which is deep inside the ear, and it's caused by a direct blow to the ear, such as slapping the ear or a ball to the ear or another implement to the ear. Could also be caused by infection, a foreign object that's in the ear, pressure change, or extremely loud noise, which causes an increased shaking of the tympanic membrane or eardrum, causing it to rupture or tear apart. Signs and symptoms, if we look in the ear, in the inner ear, we can see a visible hole. I have a picture of the next slide of this that you can see. Hearing difficulties because it doesn't vibrate as it normally does for hearing. There could be discomfort or pain, possibly leakage of fluid, pus, or blood, depending on the severity of the injury. Treatment, we want to make the athlete as comfortable as possible with a warm compress and refer the athlete to a physician. Most times, typical tympanic membrane ruptures will heal on their own over time. Prevention, not putting anything in the ears. A lot of people like to use Q-tips to dry out the ears, to clean out the ears. This is very foreign for the ear, and we should avoid putting these objects in the ear. We also need to avoid extreme pressure changes, such as going too far deep in the ocean or going very quickly up in a plane. Sometimes we get pressure changes too much as we go up in elevation. Auricular hematoma or cauliflower ear, cauliflower ear. This is caused by constant friction to the outer surface of the ear or blunt trauma such as slapping or hitting the ear. We see a lot of this in wrestling because there's a lot of wrestlers that have their face and ear into the mat as they're wrestling, as they're practicing. But what we see with this type of injury is a lot of pain around the outside of the ear, possibly ringing of the ear, tinnitus, hearing loss even, visual disturbances such as that cauliflower appearance, which is that outside swelling of the ear, warmth and swelling around the outside. You can see here how closed off that ear is, so that's why we sometimes get difficulty hearing or hearing loss. Treatment, we can put ice on it and manual compression to decrease some of that swelling. If it doesn't go away, we may need to refer the athlete to a physician to get the fluid drained and what they call buttoned, which means they put a button inside the ear so that the swelling doesn't come back. Typical prevention is wearing appropriate headgear. When you wrestle or sometimes in water polo, they wear headgear so that if they get hit or slapped, that it protects these injuries. Otitis externa is an infection to the outer ear canal. This typically occurs and is referred to as swimmer's ear. And this is when water remains in the outer ear canal after bathing or swimming. Swimmers typically have a lot of this because they're always in the water. And if the water sits, especially in a warm environment such as the ear, bacteria can start to grow, causing otitis externa. So signs and symptoms of this, we may not see specific signs and symptoms, but if we do, it could be itching of the ear, redness of the outer ear canal, slight discharge, and mild discomfort. You can see here in this picture, you can see that discharge and redness around the outer ear. And if this occurs, we need to make sure we refer the athlete to a physician. But if they're experiencing very severe signs and symptoms, we should refer them to the emergency department to call EMS immediately. Now, with this type of injury, we can use specific drops to help dry out the ear, which is typically common for swimmers, so that they decrease that water in the ear, or we get some sort of medication to help decrease that bacterial growth in the ear. Prevention, we need to make sure that we keep the outer ear canals dry after swimming or bathing, so that we get as much water out of that outer ear as we can. Otitis media is a middle ear infection. These are the types of ear infections that are painful, that are deep inside the ear, that throws off our equilibrium or balance. And this is when bacteria or viruses are trapped in the middle ear, and these cause significant pain. Could also have referred symptoms to the throat, fluid drainage from the ear, muffled hearing, difficulty sleeping on that side, and could cause actual low-grade fever because of the bacteria and viruses from that injury or illness. Treatment, usually they heal without treatment. Typically, if the ear is painful, we wait about 2 days to 3 days after being symptomatic. We can use a warm compress in the meantime to alleviate discomfort, possibly take some sort of over-the-counter pain relievers to help with the pain. But if it doesn't go away in that time period, we should refer to a physician for medication. Prevention is suggested to get the flu vaccination annually, wash our hands, and avoid smoking and secondhand smoke. Lastly, we're going to talk about nasal injuries. Nasal injuries occur commonly when that nose is not protected. So let's look at nasal fractures to start. This is caused by blunt force trauma to the nose, such as through a fist or an implement or an object. Signs and symptoms that occur are pain, difficulty breathing, could be nosebleed or epistaxis. We see a general deformity of the brain, usually pointed to one side or the other, point tenderness of that nose, and swelling. Treatment, we need to make sure that we keep the athlete as calm as possible. Treat, first and foremost, if there's any bleeding with an epistaxis to control the bleeding. Make sure that they're breathing through the mouth, and make sure that if they do have excessive bleeding and you see that the athlete is going into shock, treat them for shock and call 911 as soon as possible. Prevention for this, we can wear protective face guards, especially if the athlete is coming back from nasal fracture. You'll see basketball players wear that face guard that protects their nose, that wraps around with elastic to keep in place. Epistaxis, we mentioned this a couple times. This is a nose bleed caused by direct trauma. Could be allergies that dry up or a dryage of the nasal passages. Could be from picking the nose. But what we see in epistaxis is external nasal bleeding, difficulty breathing because of this bleeding, and pain and swelling of the nose. Treatment. We need to treat for the blood loss as quickly as possible. In order to do this, we need to pinch the nose of the athlete, or have the athlete pinch his or her nose just below where the bone is, so around the cartilage area. We need to make sure that they bend forward and not backwards. If they bend backwards, we tend to have blood drip down the throat. This could make the athlete nauseous and could cause the patient to vomit, which is an additional thing that we don't want to have occur. So we want them to bend forward and insert absorbent material into the nostril that's bleeding for about 5 to 10 minutes. We can also apply a small ice bag to the nose to help constrict those vessels to decrease the bleeding. We can also apply Neosporin or some sort of other ointment to help constrict and to stop that bleeding. Prevention, wearing protective face guards for injuries caused by direct trauma, taking allergy medications for allergies, make sure that we're not picking our nose, and using humidifiers at home. Now, this concludes Chapter 9. As you see, we did not discuss tooth injuries. These are really outside of your scope and really outside, in my background, outside the scope of athletic training. So if you do have a tooth injury, most of the tooth injuries are going to be a referral to a dentist or the emergency department. So make sure that you review this section of the textbook.